Hey everyone, we are here again for our normal health talks. But before we continue, we want to urge you to follow this page. Please like and share. Don't forget to tune the notification button and also turn the bell. At any time we drop a video, you will receive a notification and follow. Today our topic is hemorrhoids. So let's know what hemorrhoids is. Hemorrhoid is a painful swelling vein, or there are painful swelling veins in the lower portion of your bowel that involves the rectum and the anus. So let's understand the anatomical portion of this lower bowel. So you see the rectum portion is between the sigmoid colon and the anus. It's the one that holds the stool, a point where you feel the urge to go and use the toilet, but then you decide to hold it until you get to the toilet. That portion is called the rectum. And the portion that expels the stool or the feces is considered the anus. Above them is the large intestine, the various colons. So there are three types of hemorrhoid. We have the internal hemorrhoid, the external hemorrhoid, and prolapse hemorrhoid. So let's discuss the internal hemorrhoid. So the internal hemorrhoid usually is the swelling of veins within the rectum that might bleed, but it's usually not painful. So what you will see most commonly is blood stain in your stool, or whenever you clean after passing stool, you will see a bright red blood on the tissue. The external hemorrhoid usually is the swelling of veins under the skin around the anus, and is characterized by symptoms of itching, usually or occasionally bleeding, then painful swelling. That's the external portion or the external hemorrhoid. So the next hemorrhoid is prolapse. Prolapse, the rectum and the anus muscles will protrude outside. That means they will come outside, they will wash out as a result of continual pressure. So usually hemorrhoid, the general or primary cause is extreme pressure on the muscles of the rectum or the anus. That means screening severely. So discussing the causes, number one cause is screening severely. When you screen, so what are things that make you to screen? 2, heavy weight lifting. Weight lifting will make you to screen. 3, severe constipation. You cannot pass through freely. You can have a hard stool. 4, pregnancy, and heavy body weight we call obesity. There are causes and also risk factors. 5, liver cirrhosis is a condition that can cause constipation and that will also lead to hemorrhoid. So further, we have Crohn's disease. We have low intake of fiber diet. So you have the strawberry, the red berry, you have corn, you have whole grain and nuts like the almond, the beans, They are rich fiber food. You have the pumpkin and what have you, oranges. They are rich in fiber. So some other causes that are associated, we said Crohn's disease, cancer of the colon, and ulcerative colitis. So prevention of hemorrhoid, regular exercises, that's 1. 2, avoid heavy weight lifting that will make you to screen. Screening yourself because you feel that you cannot pass to in the toilet will cause hemorrhoid. If you are constipated, go and find the cause of your constipation and treat the cause. Then sitting for a long period of time, squatting and screening yourself. Obesity is one thing that will cause us. So to avoid obesity, do regular weight exercises and control body weights. Eat rich fiber diets. So they have other diagnostic procedure where you first start with the physical examination of the anus and the rectum, considering the symptoms that will present, such as the prolapse, the bleeding, the pain, the itching. Further, we have other procedures, one called anoscopy, colonoscopy, that will be done in the hospital settings using those instruments to diagnose the hemorrhoid, whether external or internal. Treatment for hemorrhoid: visit your hospital and see your doctor. Some home remedies that people apply usually is 1, soft diet, 2, applying topical steroids, hydrocortisone cream or dexamethasone cream in the rectum. But most likely it's important to visit your healthcare provider for a good health purpose. So whenever hemorrhoid is not treated properly, some complications that will come up involve serious infections. That will be followed by anemia, which is low blood from the bleeding. And then you have a skin tags. Skin tags, that is, there are skin tissue that would just be hanging out. And a dangerous one will be strangulation. Certain portion of that rectum or anus will not be receiving blood supply. As at the end result, you will experience that portion will die. And the only solution is to get it out. Surgery, which is not good. So let us prevent hemorrhoid. Treat as soon as possible you detect. Thank you so much for watching.